Have you ever looked at a patch of skin, a stubborn rash, a blister, or a darkened area on the neck and thought, that's probably nothing? That assumption worries me more than most people realize, because sometimes the body does not whisper through pain first. Sometimes it speaks through the skin. And what makes this especially unsettling is that some people discover signs of insulin resistance or type 2 diabetes on their skin before they ever hear the diagnosis in a doctor's office. That means the mirror may notice something before the lab work does. Your neck may reveal something before your energy crashes. Your feet may tell a story before you fully understand what your blood sugar has been doing behind the scenes. Where we slow down, look closer, and learn how the body often reveals trouble earlier than we expect. If you value thoughtful, practical health guidance for older adults and families trying to protect long-term well-being, subscribe to the channel and stay with me all the way through this one, because a few of these signs are commonly dismissed as cosmetic, aging-related, or harmless irritation when they may be pointing to something much deeper. The longer I study how the body changes over time, the more convinced I become that skin is not just a covering. It is a messenger. And when blood sugar stays high, when insulin runs high for too long, when circulation begins to suffer, when inflammation quietly builds, the skin often becomes one of the first places where the damage starts to show. Not always dramatically, not always painfully, but often clearly enough that once you know what to look for, you cannot unsee it. So today, I want to walk with you through 12 skin signs that may be linked to poor diabetes control or insulin resistance. Not to frighten you, not to encourage self-diagnosis, but to help you recognize when the body may be asking for attention sooner rather than later. The first sign is yellow, reddish, or brown patches, especially on the legs. These may begin as small raised bumps that resemble pimples, then slowly turn into firmer plaques with more noticeable color changes. Sometimes the skin looks shiny, almost porcelain-like. Sometimes tiny blood vessels become visible. Sometimes the area looks inflamed, then quiets down, then becomes active again. That pattern matters because when the skin begins changing in this way, I do not want people thinking only about lotion or irritation. I want them thinking about blood sugar, insulin, and whether the body is under metabolic stress. The second sign is dark, velvety skin, especially on the back of the neck, under the arms, or in the groin. This is one of the clearest external hints that insulin may be running too high. And what makes it important is that it can appear before someone is formally diagnosed with diabetes. I have seen people dismiss it as just a dirty neck, friction, heat, or age. But when skin becomes thicker, darker, and velvety in the folds, I think that deserves respect. It is often the body's way of saying, something about how I am handling sugar is no longer normal. The third sign is thickening and hardening of the skin, especially on the fingers, hands, toes, or sometimes farther up the arms and even the upper back. Some people describe their skin as tight, waxy, or strangely stiff. Others notice their fingers do not move the same way they used to. They may struggle to bend their joints fully. They may feel as if the skin itself has become less forgiving. That is not something I would brush aside, because when diabetes has been inadequately controlled for years, the body can begin changing not just how the skin looks, but how it feels and functions. And when movement starts becoming limited, that is no longer a cosmetic issue. That is a quality of life issue. The fourth sign is blistering. This one catches people off guard because these blisters can look dramatic, like the kind you might see after a burn. Yet, they may not be very painful. They can show up on the hands, feet, legs, or forearms. Sometimes it is one blister. Sometimes it is a small cluster. What bothers me here is not only the blister itself. It is the risk that a person ignores it, pops it, creates an opening, and then ends up with an infection in skin that may already heal poorly. A blister on diabetic skin is not something I would treat casually. The fifth sign is repeated skin infections, and this is one of the most practically important warnings in the entire conversation. If someone keeps dealing with fungal infections, yeast infections, infected nails, irritated rashes, or areas that become warm, swollen, itchy, scaly, or draining, I want diabetes on the list of possible reasons. High blood sugar creates a more favorable environment for infection, and once infection takes hold, it may become more difficult to clear. This matters especially between the toes, around the nails, in skin folds, and on the scalp. A simple example. A person notices peeling skin between the toes and thinks it is minor athlete's foot. Weeks pass, then the skin cracks, then bacteria get in, then redness spreads. What seems small becomes a medical problem. That is how diabetes can quietly complicate something ordinary. The sixth sign is open sores or wounds, especially on the feet. This is where the conversation becomes more serious, because now we are not just talking about skin changes. We are talking about poor healing, nerve damage, circulation problems, and the risk of infection going deeper. A tiny cut can become an ulcer. A pressure spot can become an open wound. And the cruel part is that some people with diabetes do not feel the injury fully, because nerve damage has already dulled sensation. That is why foot checks matter so much. Not every few months, daily. I think one of the biggest mistakes people make is assuming that if something on the foot does not hurt, it is not serious. With diabetes, that assumption can be dangerous. The seventh sign is shin spots. These are often light brown spots or faint lines on the shins that people mistake for age marks. They may be harmless in the sense that they do not usually hurt, but they are not meaningless. They can be linked to diabetic skin changes and may reflect small vessel damage over time. And that is what I keep coming back to in this conversation. The skin is not only showing surface changes, it may be showing what is happening underneath. The eighth sign is small reddish-yellow bumps that can appear on the buttocks, thighs, elbows, or behind the knees. They may start out looking like pimples, then take on a more yellow tone. They can be tender or itchy, and they may signal that blood sugar and blood fats are significantly out of balance. This is one of those signs that people often wait on, because they hope it will pass. Sometimes it does improve when metabolic control improves, but I would not leave something like that unexplored, especially if it appears suddenly and in clusters. The ninth sign is ring-like or raised bumps that may be skin-colored, red, pink, bluish, or purple. These are not always caused by diabetes. That deserves honesty. But they do appear more often in people with diabetes than many realize. So when I see a skin pattern that comes and goes without a clear reason, I do not like easy assumptions. I think it is wiser to ask whether this is just a skin issue or whether the skin is reflecting a larger metabolic picture. The 10th sign is very dry, itchy skin. This may sound too ordinary to matter, but I would not dismiss it so quickly. Dry skin can happen to anyone, but in diabetes it may reflect dehydration, poor circulation, nerve-related changes, or infection. And once skin becomes excessively dry, it cracks more easily. Once it cracks, bacteria and fungi have a better chance to enter. That is why dryness is not always minor. Sometimes it is the beginning of a bigger problem. The 11th sign is yellowish, scaly cholesterol deposits around the eyes. These can suggest that fat levels in the blood are too high, and when that appears alongside insulin resistance or diabetes, it can be another clue that metabolic health is not under good control. What concerns me is that people often see something around the eyes and think, beauty issue, but the body may be saying blood sugar and blood lipids need attention. The 12th sign is skin tags. Now, many skin tags are harmless, that is true. But when someone has many of them, especially around the neck, eyelids, underarms, or groin, it can be associated with high insulin levels and type 2 diabetes risk. Again, the point is not panic. The point is pattern recognition. One skin tag is one thing. A growing number of them, along with darkened neck skin, fatigue, abdominal weight gain, or abnormal blood work, tells a more meaningful story. Now, let me make this practical, because I never want information to stay abstract. If you notice a blister, do not pop it. Wash the area gently with mild soap and water. Keep it clean. Protect it with a light dressing if needed. Reduce friction. And if you have diabetes, especially if the blister's on the foot, Tell your clinician sooner rather than later. If you have a small cut or rash, do not attack it with alcohol and harsh chemicals. Clean it gently. Use appropriate wound care. Watch closely for redness, warmth, swelling, pus, increasing pain, or spreading irritation. And if healing seems slow, do not keep waiting just because the original injury looked small. If you are getting repeated infections, do not settle for treating the skin over and over without asking why the skin keeps becoming vulnerable in the first place. That question matters because sometimes the rash is not the real issue. The real issue is uncontrolled blood sugar creating the conditions for that rash to keep returning. And I want to pause here for a deeper point that I think many people miss. A lot of these skin changes are not only about diabetes being present, they are also about diabetes being poorly controlled. That means the body is not just sending a warning. It may already be struggling. That is why early action matters more than cosmetic cover-up. Better glucose control, better daily skin checks, better foot care, earlier treatment of infection, and more respect for changes that seem small at first glance. A few examples make this even clearer. A woman notices dark, velvety skin on her neck and assumes it is from sweating. Months later, blood work reveals insulin resistance. An older man develops dry, cracked skin on his feet, ignores it because it does not hurt, then ends up with a wound that becomes infected. Another person keeps treating recurrent fungal rashes with over-the-counter creams, never realizing the infection keeps returning because blood sugar has been running high for months. And someone else notices multiple skin tags and yellowish deposits near the eyes, not understanding that the body may already be showing signs of a deeper metabolic problem. These are not dramatic movie moments. They are ordinary moments. And ordinary moments are often where early diagnosis lives. So if there is one message I want to leave with you, it is this. Do not wait for diabetes to announce itself only through thirst, fatigue, or lab results. Sometimes it introduces itself through the skin first, and the skin deserves to be taken seriously, not fearfully, not obsessively, but attentively. Because the earlier a pattern is recognized, the more chance there is to investigate, treat, control, and prevent something worse. If you have noticed any of these changes in yourself or someone you love, let that be a reason to look closer, not look away. And here is the deeper lesson. The body often gives us clues long before it gives us a crisis. People who do best over time are not always the ones with the perfect body. They are often the ones who learn to notice patterns early and respond while there is still room to protect their future. So pay attention to the neck, the feet, the hands, the shins, the skin around the eyes, the places that seem easy to ignore. Sometimes what looks small on the surface is the beginning of a much larger story underneath. I would genuinely like to hear from you. Which sign in today's discussion surprised you the most? Please share your answer in the comments so others can learn from what stood out to you. And if you value honest, thoughtful health guidance like this, subscribe and support the channel so we can keep making videos that help people catch important problems earlier. Everything shared here is for general educational purposes and should never replace care from your own doctor, especially if you have diabetes, a wound, a skin infection, or a skin change that is worsening, painful, or not healing.